To start with, introduce yourself to the patient's family and verify your patient. Explain the procedure to the patient's family and discuss routine of post-mortem care with family member and ask if they wish to include their own cultural or religious practices. Also offer support from spiritual care provider and facility and ask the family members if they wish to be involved in preparation of the body.
And now, wash hands in order to deter the spread of microorganisms.
Upon entering the bedroom, make sure to check the chart to verify if the patient is right before doing the procedure, and also determine if the patient is an organ or tissue donor, and bring all the materials needed with you.
Provide privacy for patient by closing the door or the curtains in order to protect the client's dignity. For planning, prepare the materials needed. The clean gloves, gown, and other protective clothing if needed, plastic bag for hazardous waste disposal, wash basin, washcloth, warm water, and bath towel. Clean gown or disposable gown for body, absorbent pads, body bag or shroud kit, paper tape and gauze dressing, paper bag, plastic bag, or other suitable receptacle for patient's clothing, belongings, and other items to be returned to family. Envelope for valuables, identification tags as specified by facility policy in order to organize materials, facilitate easy access and performance of the procedure.
And the next step is remove all indwelling catheters, tube, tapes, and airways. Disconnect and cut off intravenous line. Leave all devices in place if autopsy is requested or required. Also, remove soil dressing and remove all jewelry and give all personal belongings to designated family member. If family requests that wedding band be left in place, place a small strip of tape around the patient's finger over the ring. And if the eyes of the patient is open, close eyes by gently pulling eyelash over eyes. Some cultures prefer eyes remain closed or open. After that, prepare a towel and wet the towel using the water basin and wash the patient's body parts that is soiled by blood, urine, feces, or other drainage, wherein this prepare body for viewing and reduces odors. Also, place an absorbent pad under the patient's buttocks. This allows relaxation of sphincter muscle at depth, releases urine or feces. After washing the patient's body parts, dry it using a bath towel. After cleaning the body, place a clean gown on patient or put the clothes that the family member provided. Facility policy may require removal after viewing. Do not tie hands together on top of body. This present body in natural, modest, and dignified state for viewing. And replace with clean gauze dressing using paper tape or cover puncture wounds with a small dressing if there's a puncture. Changing dressing helps to control odors caused by microorganisms and create more acceptable appearance. And if the person wore dentures, insert them. If mouth failed to close, place a rolled up towel under chin. And gently remove the pillow. Also, brush and comb patient's hair if that the family member wants. Next step is provide soft lighting and offer chairs for the family member and determine if they prefer to be alone or have a nurse with them. After body has been viewed, remove all linen and patient's gown. Place body in body bag with extremities straight at side and cover with shroud in accordance with facility policy. For transporting the body to the morgue, place identification card inside and outside of the body as directed by facility policy. Identify patient using two identifiers which are name, birthday, or name and account number of the patients. And place the first identification card on the patient's left foot and the second identification card pin it on the shroud. And after shroud is done, secure it with a safety pin. After that, arrange transportation of body to the morgue or mortuary. and remove the gloves and PPE and all the materials that is used a while ago and perform hand hygiene and throw it on the appropriate bin. For evaluation, observe family's response to the loss to determine level of supporting guidance needed and record the date and time of death as determined by designated healthcare professional. Also, document any marks, bruises on body before death or those observed during care of the body, and also how valuable and personal belongings were handled and who received them. Secure signatures as required by facility policy.